Hello, everyone. Thank you for joining to this session or for your interest to this topic. I'm gonna tell you about main blockchain prospects in healthcare area in the future, and I think that most of you think that blockchain it's primarily a foundation of Bitcoin and other hipster cryptocurrencies, but computer science and business leaders think that blockchain has opportunity to transform global commerce, politics, laws, and even healthcare area. So it's even expected that by 2025, more than half of healthcare administrations will have utilized blockchain for their everyday operations. And my goal today is to explain you how blockchain could be used in healthcare and why it could become so popular for this area. But before we start, I'd like to quickly introduce myself. My name is Nadezda Kharoshka, and I'm working as a business analyst in EPAM. This topic is interesting for me more than usual, mainly because I have medical background. I was graduated from the medical university in 2014. And I'm sure that your interest in this topic is not less than mine, and certainly you will have some questions to me about blockchain and healthcare, but due to limited time, I just want to ask you remember this email that you can see on the screen and send me all your questions after this presentation. Thank you for understanding. Turning to the agenda, my presentation is divided into 4 parts. And firstly, I'm gonna outline some issues that a healthcare system has, and then, secondly, I would share with you blockchain advantages that are tending to tackle some of the described above issues. Thirdly, I will come to the main part of our presentation. It's use cases overview, where you will see some concrete use cases where blockchain could bring real bonuses. And last of all, we will consider drug counterfeiting prevention use case in more detail. And let's get started with the first part of our presentation. It's healthcare system challenge. And to understand, to figure out this challenge, it would be better to start with system overlook. And from WHO, the healthcare system could be understood as following. It consists of all organizations, people, and even actions whose primary intent is to promote, restore, or maintain health. A healthcare system, therefore, it's not just pyramid of publicly owned facilities that deliver health services. To the same extent, it's transport services, insurance companies, and medical info providers, and etc. So all this complexity leads to the improving amount of challenges for each actor in this complex system. And following Pareto principle, I pointed out only key actors for you and key challenges for each of actor. And for example, patients and guardians, they are suffering from expensive services, from lack of privacy and security for patient data. They are suffering from insufficient and incorrect diagnostic treatment care. Hospitals and doctors, they have problems with staff recruitment and with data integration and sharing. Pharmaceutical companies, for example, they are fighting with drug interfeiting and suffering from stretched over time clinical trials. Insurance companies, they point out healthcare frauds and complex process of collecting patient data, and medical labs have issues with staffing as well, and with human mistakes during the work. And taking into account all these challenges, the brightest brains are trying to solve situation, to fix situation, and the following solutions were marked as the most valuable for healthcare era in the future. We can see artificial intelligence here, the branch of computer science, substitution of human intelligence, distributed ledger technology, DLT, protected by cryptography technology, Internet of Medical Things, IoT, the network of interconnected medical devices, and other. And in this list, all trends, they are sorted by the expected contribution from their implementation. And today we are going to deepen into one of the most perspective, as you can see, technology, DLT or blockchain. And our second part of 4. It's we will see here what blockchain advantages would be the most useful for healthcare in the future, and what benefits we can expect from implementation blockchain in this sphere. And undeniable values of blockchain, you can see on your screen. It's product safety, immutability, security, compliance, disintermediation, cost reduction, accuracy, and traceability. For example, traceability, ability to trace, track for full visibility, and security. Of course, we are speaking about health data that is counted as sensitive data and must be protected. As a result, product safety. Immutability, keeping records of transactions immutable. Compliance. Only know that healthcare area, it's well known with its strict government regulations, laws, and it's very important to be compliant with these laws. Accuracy. All of you know that mistakes in healthcare, human mistakes in healthcare area could cost a life. Disintermediation. You could see how many actors are involved in the healthcare system, and of course, there are a lot of intermediaries could parasitize in this system as well. So disintermediation is a removal of intermediaries. As a result, cost reduction. So what benefits in general we can receive from the blockchain implementation? It's saving time, removing costs, and improving trust. Time, it's very critical thing in healthcare. Removing costs, I think that you remember that we mentioned this challenge for patients, like expensive services. And improving trust, it's important for every system, but maybe a bit more important for such private sphere as healthcare. And just a little note about blockchain security. This technology is based on the encrypted decentralized database, and blockchain systems, they are counted virtually unhackable. And my words could be proven by Alex Tapscott, the CEO and founder of the firm that invests in the blockchain technology companies. And Alex said that blockchain systems, they aren't unhackable, but significantly better than anything we have come up with today. And that's basically all that I wanted to tell you about blockchain advantages. Main blockchain advantages that could be very, very useful for healthcare area. And now we are turning our attention to the most significant part of our presentation. It's use cases overview. You will see here 6 concrete use cases, and you will see already known for you challenges typical for healthcare area, for healthcare systems. And I will tell you how blockchain could solve these issues. And just make our journey more plausible, I'd like to invite you, I'd like to introduce you Harry. Harry is a 26-year-old man, and he's upset, as you know, because he has got cold, and now he's suffering from such symptoms as fever, sore throat, and cough. And after 2 days of being ill, he decided to see a doctor. And here we are meeting our first use case, consent management. Harry, as many of us, before visiting doctor, starts to think about problem how he can protect his personal data. And in our digital world, it has become an item of concern. And for that, consent management systems, consent will be discovered. So consent here, it's a data use permission to confirm compliant with privacy laws. And consent management systems, they are created for collecting this consent and processing them in the corresponding to regulatory laws as well. And what problems we can see in the consent management systems? The first problem is irreparability. So patients need to provide their consents every time when they provide their personal data, and it could be needed for different healthcare organizations or even for different systems. And the second problem we have here is indivisibility. So consent, it's like a global access to whole set of data, and its access couldn't be divided. So you cannot provide consent and to make accessible only part of your data. Only whole data will be accessible. And these problems, they could be solved with blockchain, and how blockchain could help for consent management systems. It could bring immutability and transparency, of course. because ledger falsifications aren't possible here, and blockchain could bring trust improvement, because trust no more lies on one actor, but rather distributed between a whole set of actors. Also, blockchain could give patient, could give Harry control over his data, and now Harry may control who may access his data, which data could be accessible, and for what operations. And since Harry could make himself easy on this role in this core, we can move on to the next use case. After Harry provides his consent, he will be directed to the specialist, and this specialist will collect from Harry information about his condition and his compliance. After that, Harry will be directed to examination, and examination results will be added to the EHR system. And EHR is electronic healthcare records. It's a digital form of health information. And despite all benefits that EHR management systems could bring to healthcare, there are a few moments that I need to point out as problems. So which problems? It's first one is the lack of interoperability, and once again, different healthcare organizations have different EHR management systems, these systems, they have a varying level of terminology, functional and technical capabilities, and all these make almost impossible integration between these systems in the future. And once again, it's bring about need to provide the same information several times. And the second problem with EHR management systems, it's data breaches. The problem that such systems regularly become the target goal for cyber attacks, and yeah, it's bad. And what achievements could health data management achieve with blockchain implementation? It's the following. It's once again, it's trust improvement. It's high level of privacy and security, and it's opportunity to exchange data between different healthcare organizations without any problems. And all these bonuses were noticed by some companies, but by many companies, and you could meet real solutions on the internet right now. It's spread enough, even now, even at this moment. And we are moving on. What's the problem Harry met here? Its problem is well known for all of us. It's a COVID situation, and now and further, Harry wants to receive medical care remotely, and if it's possible, and it's possible due to telemedicine discovery. And moreover, moreover, telemedicine could help with cost reducing and higher access to healthcare providers. And how blockchain could help here. Blockchain could help here in the same way like in previous case with data protection and data exchange, but for when we are talking about telemedicine, we are talking about data exchange between a amount of actors, all between all entities where telemedicine could be applied. So we are talking about data exchange between, not only between healthcare organizations like in previous case, but we are talking here about data exchange between transportation services, pharmacies, pharmaceutical companies, medical labs, insurance companies, and etc., etc. And that's all about telemedicine support, and we can move on to the next case. Now Harry is efficiently examined, consulted, and he received all recommendations. Time for payment. But how Harry can be sure that this treatment will be efficient for them? Harry doesn't want to pay for result, he wants to pay for service. Sorry, he doesn't want to pay for service, he wants to pay for result. And P4P, or payment for performance approach, allows him to do that. So about this approach, the thing is that before treatment, some measures are collected, and after treatment, some the same measures are collected, and based on results, the efficiency of this treatment could be defined, and based on this efficiency, the cost for treatment, cost for medical care could be calculated. This approach, it's not very spread now, it's fresh, but it's very popular in perspective, and it's proven with scientist works, and blockchain really could force P4P implementation with such benefits as transparency, the main goal of this approach, with data protection due to blockchain, smart contracts, consent management could be added to this approach as well. And we hope that this approach will change healthcare sphere only in positive way. And next use case we will discuss a bit later, but I think that that problem is clear here. And the last use case, our clinical trials boost. It's about long clinical trials, medicines that could help Harry with his healing immediately. This medicine is has the trial clinical trials for this medicine has been continuing still for 6 years, and it's really a pack when they will be finished. And it's total problem for all clinical trials. They are very long, and there are two main reasons. It's payment recruitment and retainment, and the second one, it's a long and expensive data verification process to be sure that data is free of fraud. And blockchain could help here, of course, because having all needed data, blockchain could make process of patient recruitment automatic. And the second thing, that blockchain systems can verify and timestamp data without any assistance. So it all tend to reduce costs and time for clinical trials significantly. And I'm happy to announce that Harry is healthy now, and that's all due to efficient, safe treatment, which could be accessible due to blockchain implementation. And just a few words about counterfeiting prevention way. A case, it's a real problem for all world because counterfeited drugs, they are spread through the world now, and it's a real problem for patient health and for GNM manufacturers as well. And drug manufacturers spend now large sums of money on the anti-counterfeiting measures, and most of these measures they are dedicated to the supply chains, mainly because exactly during the supplying, counterfeited drugs appear on this way. And what problems we have with supply chains? As you can see on your screen, they're really opaque, and they different for every manufacturer. Also, there are a lot of intermediaries. GPS systems are practiced very rarely, and the next problem is that patients prefer cheaper drugs, and of course, counterfeited drugs they are cheaper than original ones. And how can help blockchain with the situation, and what solution we can offer here? Of course, the first thing is to make supply chains simpler and similar with other manufacturers. For example, good idea is to reduce the amount of intermediaries as far as it's possible. And regarding blockchain, it could be a good idea to add all participants to the blockchain network, and that could make supply chains transparent and safe for drug transportation. Because every transaction will be verified with all participants and will be recorded to the blockchain system. And some companies are already offering such solutions, and that confirm that blockchain solutions here are very useful. And I just want to say thank you for your attention. And I hope you now understand why blockchain solutions, why by 2025, more than half of healthcare administrations will have been utilized blockchain for their everyday operations. And in the case of any questions or topic to discuss, you can use my email. You can see that on the screen, and contact me anytime. And I want to say thank you once again, and stay safety. Thank you very much.
Thank you.